This is the way we brush our teeth, brush our teeth, brush our teeth. This is Hi everyone! Hi guys, welcome to Ask Me Doctor Season 4, a health video series for you and your family. I'm 𝗕𝗓𝗧𝗧 from 𝗕𝗃𝗘𝗚𝗠𝗏.my, and today we'll be tackling another topic on dental care. Brushing teeth can be such a chore, especially for children with oral sensitivities. But did you know that a simple act of brushing teeth can also affect their overall health? So today we have Dr. Najib Daud from DentaLevant Dental Clinic to share his expertise in this area. So, hello Dr. Najib, how are you and welcome to our show.
Hi, I'm good, 𝗕𝗓𝗧. Thank you for having me on this show.
We have a lot of topics to talk about today. So the questions are actually in this tin right here.
Okay.
So to start off, would you be able to draw the first question out?
Alright. Well, I brought two. Oh, one. Okay.
Okay, one. Okay, so for the first question is, would you be able to explain on what is oral hygiene?
Basically, oral hygiene is about keeping your mouth in a good condition.
Okay.
People usually misunderstood that taking care of their mouth is only about taking care of their teeth. Actually, mouth is more than a teeth.
Right.
Okay, it's about teeth, gum, tongue, cheek, and other than that.
Oh, so it's not just the teeth, it's like overall mouth?
Yes. That's why we have a practice of brushing, flossing, even gargle. Okay, why? We have to do all these things because in our mouth we have bacteria, you know?
Yes.
So we have to make sure that bacteria in our mouth is under control. So by keeping our mouth in a good condition, we can make sure there's the bacteria is under control.
Oral hygiene is basically keeping your overall mouth health and clean and tidy, right?
Yes, it's not about having great or beautiful teeth only. It's about having a clean and healthy mouth.
So to jump into our next question, why is oral hygiene important? Would you be able to elaborate why it's important?
Oral hygiene, as we all know, mouth is the entry point to our digestive and respiratory tract. Like I said before, our mouth contains a lot of microorganisms or bacteria. So these bacteria can travel to other parts of our body.
Right.
So by keeping our body or our mouth in a good condition,
right,
we are reducing the multiplying of bacteria, and in a way, it prevents from cause any infection to other parts of our body.
Okay, thank you so much for sharing. What conditions can be linked to oral health?
For today, I will highlight two medical problems. First is infective endocarditis. It's about infection of inner lining of our heart that caused by bacteria of our mouth.
Oh, it can go through the heart?
Yeah, they can travel through our bloodstream
and scary.
Stick into our inner part of our heart and cause infection. That is for the first medical problem. And second one I want to touch is about our respiratory. If you ever heard of pneumonia?
Yes.
Yeah, pneumonia can be caused by microorganism from our mouth, where it travels to our respiratory tract and cause difficulty in breathing. Poor oral condition also may be an indicator that a person have other medical problem. One of them is diabetes. For your information, diabetic patients, they have a problem of low amount of saliva in their mouth. So when they have low amount of saliva in their mouth, it can cause the bacteria multiply faster. So they will attack our gum and teeth, and finally it causes cavities, gum problems, and so on.
A lot of concerns to worry about. You make me feel like I want to brush my teeth right now.
People always thought that saliva is a bad thing in their mouth. They don't like the smell of saliva. Actually, saliva is good for our body. You know, it helps to overcome, control the interaction between microorganism and our tooth structure.
So it acts like a protective layer over the tooth, right?
It is.
Alright, thank you so much for sharing, doctor. Like, I didn't know that oral health can actually affect your heart, your respiratory system, and that's actually very scary. So I think we have already concluded like why it's so important to actually take care of your oral health. Now jumping into the fourth question, are you ready?
Yes, I am.
Okay, shall we? Let me just shake it a bit so that it's more dramatic. Okay.
Let me shake it again.
How does good oral hygiene improve oral health? Okay, we already studied about the bad conditions of why if you don't take care of it properly, like now how does it actually contribute into improving overall health?
Good question again. A healthy mouth and a healthy body go hand in hand.
Right.
So to have a good oral condition for your children is more than just ensuring them have $1 million smile. Okay, for a good oral hygiene, it actually improves overall well-being of your children in many ways, such as first, it boosts your children's self-esteem and confidence.
Yep,
okay,
that's true.
Then our children who have a bad oral condition usually have less self-confidence. Secondly, it actually leads to a better quality of life. Because if you have a good teeth, good mouth, good of everything in your oral hygiene, you can eat, sleep well, even you can concentrate better during school.
Yeah.
No need to think about having toothache. Yeah.
So I think it's very important.
Yeah, true. And thirdly, actually, interestingly, when you have a good oral hygiene, it also make your memory works better. For the fourth point will be less infection, okay, in our body. So when you have a good oral condition, less infection, less trouble, okay, in your body.
Alright, so there are 4 points, right? Will you be able to just like highlight the 4th point so that I remember in my head?
Boost your confidence.
Okay.
Second, improve your lifestyle.
Right.
Third, improve your memory. Fourth, no infection or problem to your body.
Alright, so let's jump into our 5th question. How do we encourage good oral hygiene? That's actually a very good question. Like even for kids, you know, they don't understand what is oral hygiene. So how do we encourage, especially the little ones, to actually practice good oral health hygiene?
To improve or to encourage your children, one of the way is you must know that kids learn best by observation. As a parents, we must be the role model, show them what is good oral hygiene practice all about. Okay, spend some time to make sure they brush or they floss their teeth every day, and it is a must. Parents should buy a oral care product that specialized for kids. Okay, some parents they think for adults also can give same. No, actually it's not same. It will give your children excitement. Besides that, it also provide more efficient in brushing instead of using the adult product.
Even if the kids' toothbrushes are smaller, that it actually serves a purpose in...
Yeah, it serves the purpose because if it's too big, it's difficult for them to move, and plus they don't feel comfortable. Talking about toothbrush,
Yes.
It's not the size that matter. It's not about the hard bristle that matter. You have to choose very soft bristle and adequate size according to the age of the patient or person.
To all the parents out there, be sure to actually set a good example for your kids to follow, and always make brushing their teeth like a fun occasion. You know? So doctor, you mentioned that there's a difference between adult toothbrush and kids toothbrush. Can you explain more why is it so different, and why is it essential that they have a suitable smaller toothbrush for them to use?
Okay, let me show you. In front of me there is 2 toothbrush. This one is for adult, this one is for kids. As you can see, the head is different, half of the size of the adult. Okay, I'm giving you an example. Let's say this is an adult size of mouth of teeth. Okay, so for big size, no issue actually. You can just brush. Imagine you are putting in your mouth. Okay, when we brush our teeth, for this size, no issue.
Alright.
Okay, but imagining this is your child's mouth, putting a big toothbrush inside the mouth is something difficult for them to make sure they clean properly. Even when they try to move the brush according to the right method is also difficult. It will make them think that brushing teeth is hassle.
Yeah, it's very, very uncomfortable for them to actually make more movements, right?
Yeah. Buy your children a proper toothbrush. Okay, even for me, this looks so interesting and child-friendly, beautiful toothbrush. Okay, so get one instead of giving them the. I know some parents think that never mind, just they bought a bundle of toothbrush.
Promo pack.
The promo pack, and they just give to their children. So that is not a good practice.
Okay.
Invest on a small, appropriate toothbrush.
Yeah. Now we know the difference between adult toothbrushes and children's toothbrushes. Okay, doctor. So thank you so much for sharing. I do have another question in mind. So since we're talking about the brushing technique, when would be the best time to actually introduce them with toothpaste?
So toothpaste is something that people talk a lot, okay? Especially most of the dentists around this world, they recommend using fluoridated toothpaste.
Yes.
Even me for myself.
Yeah.
But for children, I know there are some occasions at their stage of life they don't know how to spit out.
Correct.
For this kind of patients or for this kind of children, I usually recommend them to take a flavored non-fluoridated toothpaste. Okay?
Non-fluoridated toothpaste.
Non-fluoridated is okay for the beginning stage. Okay? Because we want to make sure they like the habits of brushing their teeth, they enjoy, and most importantly, to keep their mouth and teeth clean.
I see.
As time goes on, maybe you can slowly change to the fluoridated toothpaste when they know how to wash and spit out properly.
I think I did see one non-fluoridated toothpaste by Morning Kids. So I guess that's the reason why they actually have it suitable for kids who cannot spit, correct?
Yeah. It's good actually. I really recommend because you don't have to wait until your children can spit to have a toothpaste. You can start anytime. If it's non-fluoridated. Fluoridated, we advise patients not to swallow. It's not good to swallow many times because it will cause trouble such as fluorosis in the later age, in the adult. You usually see the effect when we have our permanent teeth go out. For your information, fluorosis is a condition where you have white patches on your teeth surface.
Oh, that's the reason.
Yeah, that's the reason. This is due to the ingestion of fluoridated toothpaste or fluoridated water during our growing phase.
So doctor, before we end this session, do you have any other tips or advice for the parents who are watching out there today? My
advice is you have to do the right way of brushing teeth. Okay, so today I'm going to show and demonstrate to you, all parents out there, how to brush your children in the right technique so that you have a proper care on your child's oral condition. Okay? So I want to show you now. Are you ready?
Yes. Shall we go?
Let's go.
All right, let's go.
Now I'm going to show you how to brush your teeth. There are many techniques in the world. So the one that I'm going to introduce to you is the circular motion. I don't advise horizontal motion, front and back motion, because it can hurt your children's gum and teeth. Okay, so let's start. Okay, first you have to have this kid toothbrush, a proper size for their mouth. Okay. Okay, first of all, make sure your toothbrush facing the gum at 45 degrees of angle. Put it like this towards the gum. Start from front. Okay, do it circular motion. Okay, focus on the teeth. Okay, do circular motion slowly. Don't do too hard because they will feel discomfort. It needs practice, you know. So don't give up. Okay, done for the upper part. Now we go for the lower part. Same also. The toothbrush toward the gum at 45 degrees. Okay, and move circularly from back to front. Parent, don't forget on the inner part as well. Okay, you do also the same technique, 45 degrees toward the gums. Do slowly. Don't brush too hard again. Okay, after you've done all on the front and inner part, now we focus on the chewing part. Chewing part usually at the back. Okay, just do like this. Up, stroke. This one you don't have to do circular motion. Now, lastly, brush their tongue. Tongue is the place where there are a lot of bacteria. So make sure you brush their tongue every single time you brush their teeth. Okay, take out your tongue. Okay, do it like this. Yeah, just like that. Okay, good, Fahim. So repeat about 2 or 3 times. Okay, twice a day. Okay, all right. So that's all. I show you how to take care or brush your child's teeth.
Okay, we're back. So that was actually a very interesting demonstration. Thank you so much for sharing. I didn't know there was like such a technique to actually brush our children's teeth in that way.
Yeah.
Like, I always thought, giving them toothbrush is enough. Apparently, it's about getting all the right corners and making sure the gums are all clean.
Yes.
So yeah, that was actually a really good demonstration. Thank you so much for sharing. Also, special thanks to Morning Kiss for sponsoring this episode of Ask Me Doctor. Morning Kiss Junior 𝗲𝗡𝗘 Starter Kit is your kid's perfect start to healthy oral care. It is gentle on growing gums, contains no SLS, parabens, fluoride, and saccharin, making it very convenient for kids and parents. 𝗲𝗡𝗘 is every kid's dental best friend. So when 𝗲𝗡𝗘 is around, you can always count on him to make oral care a fun time for your kids. Alright, thank you so much Dr. Najib for sharing your time with us and all the knowledge that we have gained.
Thank you, Eliza. It's been a pleasure for me for this beautiful session.
Yes, I truly enjoyed it actually.
Yeah, me too.
Yep. Alright, so well, we hope you enjoyed today's program, and for more informative and health-related videos for you and your family, be sure to stay tuned on Ask Me Doctor. Thank you for watching our video. Till next time, I'm 𝗲𝗏𝗧𝗧.
I'm Dr. Najib Daud.
And this is 𝗦𝗡𝗘𝗘𝗞. Bye!